I love how you guys, the conference called Empowering You, the patient. I think that when I have my initial encounter with my patients, I cannot stress enough the fact that knowledge is really indeed power, particularly when it comes to your health. And that during that process of understanding, of asking questions, of Googling informations, of joining forums, you are empowering yourself with knowledge, but more importantly, a transformation is happening where you define your outcomes. You define your disease. You are not defined any longer by the disease. So cancer doesn't define you. Kidney disease doesn't define you. You define that. And you accomplish that by empowering yourself. So I love that. I have no disclosures, and the way I'm going to try to talk about the importance of keeping your kidney healthy is three main points. First, we're going to go over what the kidneys do, and then how do we monitor for kidney health in the clinic, and then finally some take-home points of how to keep your kidneys healthy on a day-to-day. As you probably know, the kidneys are about the size of your fist. They look like a kidney bean. We still don't know whether kidney beans were named after the kidneys or vice versa. We're not going to figure that out today, but they are there up on your back. They connect through these pipes we call ureters to the bladder, and that's where after the urethra, the urine comes out. But the main job of the kidneys is to make sure that your body is clean and healthy. And they accomplish that with two main functions. One is to remove waste and toxins. And we all produce waste and toxins every day from medications that we take, from food that we eat. Normal processes in your body creates waste. Believe it or not, taking a deep breath, for example, generates some type of waste that the kidneys have to handle. So they're very important filters, removing that waste and toxins from your body. They also remove, and you probably heard this, the excess fluid or extra water that we have, whether that is a fluid that you drink or fluid extracted from food like vegetables, fruits, or whether it's the fluid that your body produces on a daily basis. And it is really the combination of waste, toxins, and extra water, what we call urine. So yes, the kidneys make urine, but by making urine, they're accomplishing this important job of keeping you healthy. Otherwise, you will have waste and toxins accumulation that can make you feel sick, or fluid retention that can increase your blood pressure or make you even worse, swelling or shortness of breath. But what is really important to understand, particularly for this audience, is that some people are born with just one kidney, and one kidney alone could be enough to sustain all this function. There are people that are just genetically, the kidney was never developed, and it just incidentally is found on imaging that they just have one kidney. There's a huge amount of people that donate kidneys to their loved ones, family members, etc., where again they carry on a normal life with only one kidney. So that is an important consideration, because just because one kidney is removed or part of it is removed doesn't mean that you are sentenced to have kidney failure. So it's a huge spectrum. Just know that if we take care of the kidneys now and on, it is totally possible to have normal kidney function. Other than removing waste and toxins, the kidneys are also important to regulate blood pressure. Specifically, they regulate your sodium homeostasis. So it is very important that you keep an eye on that blood pressure, as it can relate a little bit to your kidney function. Another interesting fact about the kidney is that when we were in utero, there was production of blood. Obviously, when we're born, the blood is produced in the bone marrow, no longer by the kidneys, but there is a communication that is preserved between the kidney and the bone marrow. And that is that the kidneys produce a hormone called erythropoietin, or EPO, and that hormone is crucial for going to the bone marrow and produce red blood cells or new blood. So it is important to keep that into consideration. That is not just cleaning, but there are other functions. And lastly, they can regulate certain hormones, and especially those that regulate your bone health, calcium, phosphorus, etc. So when the kidneys are not working well, or when they fail, then any of these functions can be compromised. So in patients with kidney disease, for example, the inability to remove waste leads to what we call a state of azotemia or uremia, where there's accumulation of that waste and toxins. If the kidneys are not working and no longer regulate your blood pressure, then you can develop hypertension, either new onset high blood pressure or a blood pressure that was previously elevated but controlled, and now all of a sudden is severely uncontrolled without changes on medications. Red blood cell production goes down, so it is not uncommon for patients with kidney disease to have anemia. And then there's some changes on your bone, even though you don't feel them, that makes your bones weaker, prone to fractures. The challenge here, though, is that the kidney disease itself is very asymptomatic. You can have some non-specific symptoms. I will list some of them here, like lack of appetite. You can have some problems with nausea, vomiting, but none of those are really very specific to kidney disease, and they can show up in other ailments, right? So you just have to be really aware that we need to empower, again, that word, ourselves, to know how is the status of your kidney function, not just waiting for symptoms to develop. And why is this? Because in the United States, 1 in 3 American adults are at high risk of kidney disease. That's an alarming statistic. And of those, maybe 1 in 7, maybe a little bit more of those actually carry on to develop kidney disease. So none of those people know they have it unless they actually look for it. And why is that? Why is it so much kidney disease? There are so many things that can affect your kidney function. The presence of diabetes, it's probably the most common cause of kidney disease in this country, actually in the world now. High blood pressure can drive kidney disease. Heart problems because of poor pumping of your heart, poor delivery of blood to the kidneys, that can cause kidney disease, among other factors. And of course, cancer can cause kidney disease, either due to cancer itself affecting the kidney, or the surgeries or procedures like cryoablations that we do for cancers, or the therapies that we use to control cancer growth. So you can see there's a lot of environmental and intrinsic factors that can dictate your ability to have or not kidney disease. But when it comes to kidney disease and cancer itself, I think that it's very interesting, because it's like a bidirectional relationship, where you have cancer that can affect the kidney through the invasion, through the therapies we use, etc. But also kidney can affect cancer in a way that it can increase the cancer risk, but also it can change your outcomes. Mostly because having the presence of kidney disease at the moment of diagnosis of cancer usually is associated with worse prognosis and kidney survivals. And what I mean by that is that when kidney disease is diagnosed in someone with a recent diagnosis or history of cancer, this leads to increased risk of toxicity from chemotherapies or any other agents. It can lead to interruption of therapy. That's probably one of the most stressful things that a patient can go through, when you have someone that understands that they need this therapy to stop and fight cancer and win that battle. And now they're told, no, we cannot give it to you because your kidney numbers are not looking right. That creates a lot of anxiety. That creates a lot of fear. So it leads to that, unfortunately. It also leads to dose reduction of medications that probably were better at higher doses, or even worse, to selection of other agents because are more kidney friendly, but they're not as potent as those that can affect the kidney. Increase the risk of hospital stays, which drive cost and mortality. And also important is it reduces the ability of these patients to participate in important clinical trials, so we can push science further. So cancer treatments can affect the kidney in different ways through standard chemotherapy, like for example, cisplatin. It can damage the tubules, which is a important part of the kidneys to filter. Immunotherapies, it can cause an allergic reaction. As you know, when you get immunotherapy, your immune system is just revamped to attack cancer, but by doing so, it can also attack your own cells. Kidneys could be one of those. Targeted therapies, radiation it's not very common, but massive doses of radiation can cause something called radiation nephropathy, or kidney damage due to the radiation if it's tailored to that area. Surgery, of course, because you have decreased kidney mass, but also the intrinsic problems with surgery, where you can have bleeding, you can have drops on your blood pressure, etc. And then finally, what we use for surveillance, specifically the contrast that we use for CAT scans that can also cause acute kidney injury. So how do we know? How do we monitor? And why is it important for patients to understand to monitor kidney function? Well, first, because patients with cancer are at high risk of kidney disease, and I already explained why. But also because kidney disease may be present even without symptoms. So you will not know unless you actively ask for a specific test to look at your kidneys. And we're going to talk about what those look like. And then finally, the benefit of this is that if you do yearly kidney function monitoring, you can potentially prevent or take action to arrest the progression of kidney disease if it happens. So how do we do that? So how do we diagnose kidney disease? There are different ways, and I'm going to list the three most important ones. The first one is to look for the presence or absence of protein in the urine. What does that mean? So imagine that the kidney is a very tight filter, represented there by that blue line. It is a tight filter and it's very selective because waste and toxins should go through, but the good stuff should stay in your body, like cells, proteins, vitamins. Those things are not being filtered out. The problem with kidney disease is that the selectivity, the ability of that filter to preserve the good things in your body is lost. And in that scenario, then you start filtering things like proteins in the urine, and that you can pick it up in the urinary space where it should not be. So the fact that you are spilling protein in the urine indicates to me that that filter integrity is lost for whatever reason. So that is a way that we can early diagnose kidney disease in patients. So it is one of the earliest signs. So even when your kidney numbers look good, you can have that. That by definition is kidney disease. But it's also associated with worse outcomes for the kidneys. I'm going to show in the next slide. This is a graph that shows in a 10-year follow-up average, the cumulative risk of developing kidney disease. And as you can see, those who have no protein in the urine have significantly less risk of kidney disease compared to those with moderate, severe, or extremely high levels of protein in the urine, suggesting that just having protein in the urine by itself is not just a diagnosis, but also how much protein in the urine do I have? And what are we doing to bring that level down to save my kidney function? So other than and that's it's done with a urine test. So it's a random sample. It doesn't need to be a 24-hour urine collection. It's a random sample, and the lab should be able to run and tell us how much protein you're spilling. It is important to know that it's not a regular urinalysis, but actually we need to measure and quantify that protein excretion. The next test is a blood test. And what we're measuring here is something that's called creatinine. Do you guys have ever heard about that terminology, creatinine? Do you guys know what creatinine is? So creatinine is a waste. Remember, kidneys remove waste. So creatinine is a waste that comes from your muscles. So every time that we move around, the muscles are releasing waste or creatinine in the blood. As the blood goes through the kidneys, again, thinking about that coffee maker filter, as the blood goes through the kidneys will grab that creatinine and put it in the urine. And the kidneys are constantly removing creatinine from your blood, which means that if the kidneys are doing what they're supposed to do, removing creatinine, that level, if we measure in the blood, should be low. The lower, the better. If for some reason the kidney is affected, surgery, medications, diabetes, they no longer do an effective job removing creatinine, so creatinine starts to accumulate. So when we see that the creatinine goes up, we usually assume that is because the kidneys are not doing a good job removing it. So that is how creatinine becomes a marker of kidney function. The higher the creatinine, the worse the kidneys are doing. And it's not just about the absolute number. I don't want you to look at a creatinine and say, oh, it's elevated, and just, oh my God, freaking out. It is more about the trend, because certain things can cause elevation of the creatinine and then the creatinine goes back to normal. Dehydration, very low blood pressure, certain medications, antibiotics, all of those can cause an elevation of the creatinine, and then you sit tight, repeat a few months later, and then the creatinine is back to your normal or baseline. So it's just, to me and to us kidney doctors, the most important thing is that trend. So trying to focus on where is that trajectory over the past year or so of that creatinine. This I'm showing, it's busy, but it's important to understand the concept that I just mentioned of the creatinine, which defines what stage of kidney disease you have, and the protein in the urine, which gives you the prognosis of how likely this will progress. And I pay attention here, for example, in CKD stage 3A, which is less than stage 3B, those patients with CKD 3B that are not excreting protein in the urine have a high risk of progression. But even if you have a better creatinine, which is calculated by the GFR, but you're excreting a lot of protein, the risk is worse. So that's how they complement each other and help us understand what is your risk based on your creatinine and based on the amount of protein that you are excreting, if you are. And then finally, blood pressure. So if you have history of high blood pressure and you check your blood pressure every morning and it's 110/70 or 120/80, and all of a sudden, for the past week or month, you're seeing readings on the 150s, 160s, and you have not run out of your medications. You're watching what you eat, not excessive amount of salt. It's not Thanksgiving or the holidays. Then that should alert you that there might be something potentially related to the kidneys. We do know that there are medications that we use in patients with kidney cancer that can increase your blood pressure, which is actually a good thing a little bit. But if you're not in that category and you were just in remission or surveillance and your blood pressure changed, then you might want to alert your doctors about this. There's something is called cystatin C. I mentioned this because in prior talks, a lot of patients have questions about it. Cystatin C is different from creatinine, but it also measures the same thing. It's also another waste, but it's not produced by muscle. So it has less bias in terms of patients that have lost a lot of muscle mass, especially because of chemotherapy, or patients that have a lot of muscle mass because they're bodybuilders and things like that. So it's just a different way that we can measure through blood kidney function. So what can we do then? What we have a diagnosis or concerns for kidney disease. What can we do moving forward? First, I will stress out blood pressure, and that the patients that come to see me know how much I hammer down high blood pressure because it is one of the most important factors that are modifiable and have an amazing outcome in terms of preserving your kidney function. Okay. The analogy of gardening roses, I always tell them. So imagine that you are watering roses with a hose, and the roses and the plants want to get that nice flow of water, right? But if you put your thumb at the end of the hose and you increase the pressure of how that you're delivering that water, you're slamming those roses. They're going to fall apart, right? So that's exactly what happens to the kidneys when you're slamming with a high blood pressure of 160/90 day after day after day. It just creates damage that way. So we really want to make sure that your blood pressure is well controlled. The one other point I want to say about high blood pressure is that, yes, high blood pressure can cause kidney damage. That takes years, right? So this is something that takes years. You're not going to have kidney damage rarely. You're going to have kidney damage from overnight. But low blood pressure, very low blood pressure, the one that makes you feel dizzy when you stand up, that can damage the kidney in hours. So you have to have a happy medium, as close to 120/80 as possible. That's what I say. But keep in mind that very low blood pressure, and that's going to be relevant if you are having diarrhea, vomiting, not eating properly, or losing weight, and then the medications were not adjusted. So now you're getting over medicated. I want you to please pay attention to that. There's a huge misconception that the lower your blood pressure, the healthier you are. And it's not, especially if you only have one kidney. So we want to keep that blood pressure in a healthy 120/80. A big aha moment for my patients is what to do if your blood pressure is low. So let's say you're home, you're vomiting, you're having diarrhea. You check your blood pressure every morning is 120/80, but you've been vomiting a lot. And today you wake up and blood pressure is 90/60. What to do? 90/60 is low. And if you put that medication for blood pressure on top of that, you're going to bottom down. And that kidney is not going to receive blood supply. So empowering, again, that word yourself to understand that if your blood pressure is low, it's okay. You have a kidney doctor's blessing to hold your blood pressure medications in the event that you're sick and your blood pressure is low. Also, if your blood pressure is low, to bring your blood pressure up is not just by drinking water. Water will do nothing to your blood pressure. In that rare instance where your blood pressure is low, you might want to grab some salt or sodium to increase your blood pressure. Think about if they give you an IV in the emergency room, it's going to be saline. So it's really the sodium that affects your blood pressure. For the same reason, that's why we ask you low sodium with your diet to control your blood pressure and keep it down. So go as close to 120 over 80. You want to check regularly, even if it's a very boring 120 over 80 every day, but just checking regularly is what is going to capture that low blood pressure if you're not feeling well. You can be completely asymptomatic. So just don't think, oh no, but I don't have a headache or I don't have blurred vision. My blood pressure must be fine. You can have a blood pressure in the 180s with no symptoms. So we manage that by restricting the amount of sodium, try to exercise if you can, as much as you can, weight loss. If there's tobacco consumption, try to stop that, and then taking blood pressure medications as instructed. Am I bad on time? Diabetes is a very common risk factor for kidney damage. So you want to make sure that we control diabetes. And by control, we mean a hemoglobin A1C less than 7%. For those who have diabetes, they know what that is. It's usually a way that we assess and monitor blood sugar. Low carbs, and then there's specific type of medications for blood pressure control that in patients with diabetes we recommend, which are the ACE inhibitors or ARBs, losartan, lisinopril. Diet, important for kidney health. We like to divide the plates in quadrants, and we want two of those quadrants to be a healthy plant-based protein. Vegetables, fruits, grains, nuts. Then one other quadrant could be your starches, carbohydrates, and then one other quadrant could be your protein. Now, we did a lot of recommendations back in the 90s and early 2000s about protein restriction in patients with kidney disease. And today, we know that it's not so much about the amount of protein, but more the source, meaning plant-based protein is more kidney-friendly than animal-based protein. Now, I am not asking anybody to become vegan or vegetarian. If you are, that's perfectly fine. What I'm asking is that you want to capitalize on those vegetables, nuts, fruits. And animal-based protein, we recommend mostly turkey, chicken, fish, and seafood more than red meat. The redder the meat, the more acidic, the harder for the kidneys to process. You still can have a steak. You still can have a burger that is not contraindicated at all. Maybe once, twice a week. You don't want to do that every day. Okay? As I showed this picture, and of course, a delicious steak. But yeah, take care of the kidneys through diet. It's important. Your kidneys will appreciate that alkaline-based diet because it's easier for them to process that food. No, alkaline water will not work for kidney disease or drinking baking soda on a regular basis. It's just a matter of how you metabolism and handle these proteins. So again, empowering yourself, know what your numbers are. Ask if they haven't told you, what is my urine looking? Does my urine looks healthy? Am I spilling protein in the urine? That's a very fair question to ask. What is my creatinine? But more importantly, know your baseline. Don't freak out if your creatinine is mildly elevated. A lot of people have after surgery, but the important thing is, what is it looking like? Am I at 1.4? Plus minus 0.2 points, like 1.4 to 1.6 or so for the past year, they're in good shape. And you can have a normal life with that. But is it trending? It's 1.4, but now it's 1.8. And then you go a month later and it's in the twos. That is a trend that is worrisome. Avoid this class of medications if you can. I know pain is important and it can impact your quality of life, but these are detrimental for kidney function. They can decrease the blood supply to the kidney and it can damage them. So those are what we call non-steroidal anti-inflammatory drugs. That's your Motrin, Aleve, ibuprofen, naproxen, Advil, etc. And then last, if kidney fails, that's not the end of the road. There are options to replace your kidney function, whether that is through dialysis, and there are different ways we can do dialysis in this country, at home or in a center, or through transplantation. But I think the most important thing that I want you guys to understand is that you have to be proactive, you have to stay well hydrated, avoid unnecessary NSAIDs if you can, keep your blood pressure at goal. Ask about your contrast, what's your creatinine, what type of contrast I'm getting. Tell your doctor about supplements or herbs or over-the-counter medications that you're using. If you have some new onset swelling or newly uncontrolled high blood pressure, let us know as well. I'm going to end by reminding you that the kidneys are a pivotal role in cancer care. The prevention and early detection of kidney injury can save function and prevent further progression. In communication with your team is critical, and you can take simple, effective steps starting today to help your kidneys. These are some resources you can go online at National Kidney Foundation, the NIH. And with that, happy to entertain any questions.